Namaskar. Very good morning to you all who watch Health Hour every week, and this is an exclusive show where we bring Apollo's experts to the live show every Sunday. This is a platform where you can ask all the questions that you hesitated to ask or hadn't found time to go to a physician to ask the questions. So this is a place where you can come onto YouTube chat and type your question. We shall bring you an answer from our expert. You must be watching this on Facebook pages. You must be watching this on Instagram live as well. But if you have a question or a query to be answered, please do come on to the YouTube chat live, where on the chat box you can text your query and I will take it up to the expert who's going to join us very shortly. Also download Apollo 24/7 app because we're going to have a health quiz on the show and I'm going to ask you 3 questions. You will win gift vouchers from Apollo 24/7. Also towards the end of the show, we are going to give away gift vouchers and discount coupons which you can use in Apollo 27. चलिए Apollo 27 डाउनलोड कीजिए, which is going to give you the entire Apollo Hospitals facility in one app. Power of health just with one touch. तो आज हम बात करने वाले हैं प्लानिंग प्रेगनेंसी, what's to be done, what's not to be done, and what can you avoid, what are the risks, and everything related to planning pregnancy. आज हमारे साथ ज्वाइन होने वाले हैं a very famous gynecologist and obstetrician, Dr. Parul Sathe, who's joining us from Apollo Hospitals, Navi Mumbai. 14 years का मैम का एक्सपीरियंस रह चुका है and she's a member of FOGC, AMC, NMOGS and MOGS. She's received NA Purundare Award for her paper presentations and various articles and international national journals में मैम के publish हो चुके हैं and she's an expert who can be consulted for high risk pregnancies, ovarian cysts, fibroids and infertility as well. चलिए पारुल साथे जी को इनवाइट कर लेते हैं. Here's Dr. Parul Sathe. Very good morning, ma'am.
Good morning. Very good morning.
Yes, we know that gynecologists के Sunday नहीं होते, Monday नहीं होते, बच्चे जब भी आते हैं आप तो तैयार होते हैं. But thank you so much for joining us on this Sunday morning, Dr. Parul. बच्चे जब
My pleasure.
Yeah. Ma'am, let me start with this question. जब उनको बाहर आना है तभी आते हैं. वो टाइम अपने हाथ में नहीं होता है. But planning pregnancy, that requires some amount of planning. One should be prepared is what I believe. Why is it important to do so?
See, the thing is that all of us nowadays, each and every pregnancy is precious. We plan 1 or maximum 2 kids nowadays, right? So it has to be a safe, healthy pregnancy. That is what all of us want. We want safe pregnancy and safe motherhood. So we should plan it well. When we can plan everything in life, why should not we plan our pregnancy and a safe delivery? That is the purpose of planning our pregnancy, right?
बहुत प्यारा बोला है कि जब सब चीजें प्लान करते हैं, फाइनेंशियल, एकेडमिक, एवरीथिंग इज प्लान. घर बनाने के लिए भी बहुत अच्छी तरह से हम लोग सालों बैठ के बैंक ढूंढ के बिल्डर ढूंढ के जब घर बना सकते हैं, तो बच्चों के लिए भी इतना सारा प्लानिंग चाहिए. सो what is the most important for men and women to understand while planning pregnancy?
First of all, we should realize that nowadays our priority is our career, our ambitions, and we keep family a bit secondary, or rather I should say we feel once I am financially secure, once everything is settled, then I will plan my pregnancy nicely. So we should understand that age is the factor which affects our pregnancy planning a lot, right? So if you are planning pregnancy, it has to be in your late 20s or latest early 30s. If you are delaying the pregnancy, problems are going to occur. Number 1. Number 2, our diet. Nowadays, we are so busy working. Our lifestyle has become such that we don't have time to eat healthy food, to cook food for ourselves. See, on the go, we take something, we eat something, we grab something, and that is how we are leading our life right now. But if you are planning pregnancy and if you want a healthy baby, please focus on your diet and your lifestyle. That is going to help you a lot. Nowadays, all of us are working.
तो एज जो आपने बोला, let me start with the first factor. Planning pregnancy में age is very important. So let's start with the female's age. जब हम समझते हैं कि मेनार्की जो होता है, पहला मेंस्ट्रुएशन पीरियड जब
Period.
होता है तब से लेकर अगर हम ओवुलेशन शुरू करते हैं, तो व्हाट इज अ गुड टाइम टू बी फर्टाइल एंड टू हैव अ बेबी?
So it is in our late 20s, that is the ideal time that we should plan our pregnancy. Latest early 30s. We should understand that when a girl is born, she has a fixed number of eggs in in her body, right? So God does not create new eggs as we grow up. We have a fixed reserve. वो बैंक में उतने ही अंडे हैं. As we grow old, our eggs are exhausted. After menarche, in every month, we are exhausting our eggs, right? So that is why by the age of 50, all the eggs are exhausted and we attain menopause. So as we grow old, our eggs will also grow old. No new eggs are formed. How your skin is aging, your hair are aging. Similarly, your eggs are also aging. So it should not be too late that, oh, your eggs are too old. Now there are high chances that you will not conceive on your own. Even if you conceive, chances of miscarriage are high. So before that, we should plan our pregnancy so that we get good and healthy baby. So ideally, late
One,
20s is the best time to conceive.
right. So we will talk about age related women में जो भी risks आते हैं वो थोड़ी देर में फिर से बात करेंगे. But age in men and the quality of the sperm that they produce, how important is this for
Yeah.
planning a pregnancy?
Now I should say मर्द कभी बूढ़ा नहीं होता. You know, men have got this thing. Every 3 months new sperms are formed. So there
अरे
is
वाह.
per se nothing. Yeah, every three means sperms are formed every 3 months. So per se every 3 months they are getting new sperms, so that aging directly does not affect sperms. In case there is some trauma to the private parts, or in case there is some surgery on the private parts, then these get affected badly. But in every 3 months new sperms are formed. That's why we don't emphasize on men's age that much. But yes, women
हाँ.
definitely. But smoking and lifestyle again affects the sperm's quality. So if you are indulging into all these things, as your age advances, sperm's quality reduce. So that is what we have to focus on.
Yeah, but quality of the sperm is important. It's not about
Yeah.
how fresh or how are you able to produce your sperm every 3 months है या नया है मैं तो lifelong produce करूँगा. That's not the question. It's about the quality that you have asserted.
Yeah.
You have made sure
So
that it's very
quality depends
important.
on your lifestyle. Diet and lifestyle
Hmm.
again. If you are smoking, the motility of the sperm, see, sperm has to travel and reach the egg, right? So if the motility of the sperm is affected, it gets affected badly by smoking, then the sperm will not be able to reach the egg only, and then chances of conceiving are bad. If the semen is not of good quality, if you are not taking antioxidant and vitamin and mineral rich diet, then the embryo, the baby which is formed, is not good quality. It may not stick to the womb. High chances of miscarriage and high chances of forming abnormal babies are there. So lifestyle has to be focused on, diet has to be focused on, strict no to smoking, strict no to caffeine intake. In fact, we should restrict coffee also to maximum 2 cups in a day, not more than that. And tobacco should be avoided. So
Wonderful.
that is what we
Ma'am,
have.
so this applies to men and women both. So how
Both.
long? See, अपने अभी आजकल के सोसाइटी में स्मोकिंग बोलिए, अल्कोहल बोलिए, सोशल प्रेशर्स के साथ this has become so run of the mill kind of lifestyle habit. So if a couple is planning pregnancy, what would you advise that they should quit smoking and alcohol for what duration?
Minimum 3 months before planning pregnancy. Ideally 6 months. That is how it
Ideally
should
six
be.
months. Yeah, very
Minimum
very
3 months.
important.
Yes.
So you
And
have
during
to keep this
pregnancy,
in
they
mind.
are just not allowed to. Pardon? Hmm.
No,
Tell
please
me,
continue,
Nancy.
ma'am. Please.
And during pregnancy, it's a strict no-no. Strict no-no. It will
Wow.
affect the baby. Hmm.
I love the way you said strict no no. Just like one professor you say. So बच्चों को जब हम बताते हैं कि ये नहीं करना है. So it's
नहीं
one of
करना है,
those
नहीं.
very strict
Because
warnings
it
that you're
affects the
giving.
fetus badly. Hmm. That is what we don't
Exactly.
want at all.
Yes. So now we understand that one has to be ready, accept the fact that a healthy pregnancy can be gotten only by healthy parents. So you take care of
Yeah.
your lifestyle, and you also take care of your health first. And what are the stress related, anxiety related issues that one also has to address?
So one has to understand that if you are stressed out, if you are over involved, over ambitious into your work or family pressure, then the hormones in the bodies they go haywire, and then it becomes difficult to conceive. Okay, and we should also understand that if everything is normal with the lady and with her husband, chances of conceiving in 1 month are only 8 to 10%. That is the probability of conceiving in 1 month. There it is maximum 10%. So if you are planning pregnancy this month and you don't conceive, if you get your chance, you should not get disappointed. Oh shit, yaar, try kiya hua nahi. It should not be that way, because every month you start thinking that way, the stress level goes high. When the stress level goes high, the chances of conceiving reduce. So we should try to keep ourselves calm and give ourselves time, at least 6 months. I would tell you that we doctors start treatment for infertility or subfertility if you have tried naturally, properly, regularly for 1 year. And still, if you don't have baby, then we label you as subfertile. Otherwise, when
Yeah.
there is a probability of 8 to 10%, you will conceive in a year. So don't panic. Please don't let that stress come over you. I hope
Ah,
I am clear.
very, very clearly said, मैम. Very well mentioned कि हमारे इसमें कल्चरली एक साल के अंदर ही शुरू कर देते हैं, बड़े लोग होते हैं या सोसाइटी में काफी सारे इश्यूज ऐसे आ जाते हैं कि अरे इनके बच्चे नहीं हुए. Of course, now a lot of people are trying to get into one zone where not they're not answering this, but in the what do you call, in the main strata, ये बच्चे नहीं हुए एक साल के अंदर, it's going to be one बोझ, and it is
Yeah,
going to
true.
affect is what I understood now. Dr. Parul has said
Yeah.
very, very important. Yeah, now let me also start taking questions from our audience who are joining us. आज थोड़ा
Yeah.
audience YouTube chat पे थोड़े slow है. Audience who are watching this on Instagram and Facebook, you're typing your queries there. Please, I'll not be able to see them because I'm monitoring only YouTube chat live content. So please hop on to YouTube chat and type your question in the YouTube chat box. So follow us on Apollo 24/7's YouTube channel, and you will also find, yes, I can see a lot of people are now typing. Thank you so much, all of you, for understanding me. Amrit Kaur पूछ रहे हैं, hello ma'am, I've just delivered my first child 3 months back. I'm 34-year-old now. My question is, when can we plan for my second child? Should there be a gap for the second child, and what is the best time?
Yeah. I would like to know whether it was a normal delivery or a cesarean section.
Yes,
If it is a normal,
अमृत कौर जी, अगर आप सुन रहे हो तो प्लीज गो अहेड एंड टाइप आपका नॉर्मल डिलीवरी था या सिजेरियन है. मैम आपका आंसर कर देंगे. एंड शी इज ऑलरेडी 34 ईयर ओल्ड, एंड तीन
yeah,
महीने
yeah,
पहले
that is what. See, when
बच्चे
it
को
is a cesarean section, it should be ideally minimum 18 months gap. Minimum. Okay, then only you
ओ
should plan, because the first wound needs time to heal. When we do the cesarean section, we cut your womb and we take the baby out and then we suture it again. So when we see
हाँ
from outside, the wound looks very healthy, but inside,
right.
internal organs, they
um,
need at least 6 months
Amrit
for
Kaur has,
healing.
sorry ma'am, Amrit Kaur
Yeah.
has replied she has a C-section delivery.
So ideally, it should be minimum 18 months gap, and you should keep your diet very strong, because you must be breastfeeding right now. So you should take supplements and you should take healthy diet so that you can plan next pregnancy early, right? So that is how it
So
is.
in the age factor, I think she's worried because she's 34, and that's the reason
Yeah. So
she must
maybe
have
at 35%
prompted.
you should start. Yes, yes,
Not to
yes.
worry,
But
not
we
to
have
worry.
to see
Yes,
this also, that wound should heal. If the
that
wound
is very
doesn't heal,
important.
then it will be life threatening for her. Okay.
Yeah, Amrit Kaurji, I think your question is answered there very well. Next question is from Mr. Siddharaju, who's 32-year-old male. Basic follow-ups to a normal and healthy pregnancy. What are the basic tests that one should take?
Yes. See, when you are pregnant, you should reach your gynac so that we can elicit your history first. That is very important, so that we can stratify risk for a high risk pregnancy. If it is a low risk pregnancy, then we do routine antenatal tests, which include hemoglobin, your routine, your blood group, your thyroid, your sugar levels. We do a special glucose challenge Then we do husband's blood group and HB electrophoresis. These are the basic tests which we do apart from an early pregnancy sonography to see how the baby is. And then this is usually at 6 weeks. When you test positive, you usually come after 10 to 15 days to your gynec, and then we start doing. Then we call you at 3 months for further sonographies and further tests, and we evaluate accordingly. Right.
Right. So all these tests can be found on Apollo 24/7 as well, and
Yeah,
especially there
yeah,
are
yeah, yeah.
curated.
We have
There
a
are
special
doctor curated.
ANC profile. Yeah.
Ha.
So that
It's
is
called a
what we order,
ANC
ANC
profile.
profile. Yes, yes. So ANC profile plus early pregnancy ultrasound. So that is the first thing which is to be taken. So all the tests of pregnancy are included in that ANC, antenatal care profile. That is what you have to do.
Wonderful. Thank you so much. And that will be found on Apollo 24/7 app as well. So, Dr. Parul, also before one starts to get even pregnant, what are the tests that they can do to see how fit they are, and what are the parameters that they have to correct? Like, folic acid ho sakta hai, iron ho sakta hai.
Yeah. So first we do CBC, that is in which we check your hemoglobin, your platelets, your WBC. We check your thyroid levels, very important. We check your sugar levels, very important. Then HIV, all sexually transmitted diseases are checked in that. And we check for IgG rubella antibodies. Basically, rubella is a viral infection. Usually, we give vaccine for rubella in childhood, but previously it was not given. So all women are not immune to rubella, and if we get this infection during pregnancy, baby can get affected. So what we advise, we do IgG rubella. If it is negative, that means the woman never got rubella during her this life. We give a vaccine, tell them to wait for 1 month, and then we tell them to plan pregnancy. If she is 35 years, 34 years, then we advise AMH levels also to see how fertile and the quality of her eggs. That is how we go
What is
about
that
the
test,
things.
ma'am? Can you please repeat that, ma'am?
Anti-Mullerian hormone, AMH level. This AMH
AMH
level,
level.
this hormone is secreted by the ovaries, and we that tells us, it gives a fair idea of the quality and the quantity of eggs which she has, and how fast she has to plan her pregnancy now. That is how.
Wonderful. Wonderful, ma'am. Thank you so much. And all these tests, as I've mentioned earlier, can be found on Apollo 24/7 app. Now you can order medicines or book a test from your comfort of the home. You can do a WhatsApp as well. On the screen, there's a number which is being scrolled. So please go ahead and text or WhatsApp. Ma'am, next question is Naina Devi Shivalli. Her name is her name. That's her name, and her age is 36. Doctor has told me my eggs are not there; they're all finished. So can I
Hmm.
get pregnant? So I cannot get pregnant. I'm sorry, I'm not understanding her English
Yeah, yeah,
typing.
yeah. I'm
So
understanding you. Tell. Hmm.
yeah. So her name is Naina. Her age is 36. Doctor has told her eggs are not there and finished. So I cannot get pregnant. Is that a possibility? And in such cases, what can one do?
Yeah. So if your doctor must have assessed your AMH level, and they must have done a sonography to see for antral follicle count. When this is very low, which that is what I told, after 35, the fertility declines rapidly. And in some women, it is rather very fast. So in your case, if the doctor has told you that the eggs are not there, then chances of conceiving spontaneously are very low. And moreover, even if you conceive, chances of miscarriage are high. That means if the quality of egg is not good, the quality of the baby or the embryo which will be formed will also not be good. So in such cases, usually IVF specialist is the person who guides you the best. They may advise donor eggs to you so that your husband's sperm can be used and donor eggs can be used and the embryo can be formed. And the embryo is implanted in your womb and you carry the pregnancy. That is how it goes. Right.
All right. So the entire procedure is now normal. उसके बाद से जो भी वो करेंगे वो
Yeah, she will
उनके
carry
womb
the
पर.
pregnancy. She will deliver. Yeah, yeah, yeah. Yes, yes.
Yeah.
So we have
Wonderful. Yeah.
special banks nowadays, sperm banks and egg banks, from where we can get. That is how it is.
Right. So इंदरलोक जी पूछते हैं मैम व्हाट्स द सिग्निफिकेंस ऑफ AMH लेवल्स इन फीमेल. अभी आपने बोला है बट वन क्विक राउंड what's the
Yes.
significance?
See, AMH, this is a hormone which is secreted in a woman's body and which will help us assess the quality and the quantity of eggs in her body. And this is how we assess the fertility level of the female. If it is between 2 to 4 in Indian women, we say that her fertility is good. Okay.
Okay, good ma'am. Yeah. So Indian women के लिए अलग है, and then that means rest of the world
Yes,
and
it depends
especially
according
American
to
and
the
European.
races. Yes.
Okay,
So for
okay.
Indian
So,
women, 2 to 4 nanogram per milliliter is the ideal range. Okay.
so I would
If you see
advise
the
अपने
report,
audience, yeah, अपने audience, most of us at our home sit at the comfort of a home. Internet ले लेते हैं, search bar में type कर लेते हैं, and we go by a lot of internet given solutions. So we should
nowadays,
not consider those. Indian standards, Indian levels are
true,
different, is what one should understand.
different. That is
Right.
what they come and they
Yeah.
ask
Doctor,
us also. In this report, doctor, this is written normal. In this report, we consider what is standard for us. Our references, our women. That is how it should be.
correct. Next question is from Mr. Dhanu. Hi, Dr. Parul. Good morning. My wife got pregnant recently, and I'm afraid she might have gestational diabetes. What should we do to make sure that she's not developing it? That is one question, not developing it, but if they have developed, what's to be done?
What to do next. Yeah. So if she first we have to focus on diet. Once you find that the sugars are deranged, you have to stop sugar completely, especially in our tea, coffee, and all. And then she has to exercise regularly, and stress should go down. These three factors is what you can do to prevent her from developing GDM. If she has already got gestational diabetes mellitus, for 15 days we do strict dieting by monitoring sugars regularly. HGT test is what we do, okay, glucose testing. And then after 15 days, we reassess how she is. We do her fasting and post lunch sugar. Still, if the sugars are high, we involve an endocrinologist. We put her on metformin and then we monitor the sugars accordingly. Because maintaining sugars in normal range is very important during pregnancy, as high sugars may affect the baby and the mother adversely. So we have to be very, very careful regarding this. Okay. If the
Okay.
sugars are very high in first 3 months, chances of getting abnormal pregnancy, abnormal baby are high. So it has to
Yeah.
be under strict control, and we should not feel nahi 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 insulin nahi lena, nahi 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 aisa nahi karna. That should not be the attitude. Our aim is to keep our sugars under tight control. Okay.
All right. Ma'am, here Danu has expressed that he's afraid that she might have gestational diabetes. इसको कैसे rule out किया जाए? अगर इनको doubt है, तो I
That
suppose
is
the
what in
experts are the
ANC
one.
profile. In ANC profile, we have one test in which we give a glucose load to the patient. We give a G75 powder, we dissolve in a glass of water, and the patient has to drink. And after 2 hours, we check her sugars. When we give this glucose load, the lady who is prone to develop GDM, her sugars come high. So we know she is high risk of developing GDM, and then we treat her accordingly. So this is a part
Ah,
of our ANC profile. That is what we do.
yeah. I hope Mr. Danu must have gone through this entire routine checkup and then he is coming to this conclusion.
Yes.
If you have any doubt, I think Dr. Parul has given us good tips to maintain her diet, and then please continue taking care of her. So no stress, please. I hope you understand the value of the good
Yes.
partnership, and reducing the stress is also in your hands. Thank you for understanding.
Especially in
Right.
GDM, we are supposed to take frequent small meals. And normally to a pregnant women, we advise take multiple fruits. For patients with GDM, we tell them you take one apple at a time. Don't take mangoes, chikus, and all. So that is how, and 6 meals. Rather than taking one heavy meal, you divide it into 6 parts. Right? Normally,
Yeah.
what we do is one breakfast, one lunch, one dinner. In these cases, it
Yes.
has to be 6 meals. Okay.
Yeah. Yeah, done, ma'am. Next question I would want to take is Prem Kumar's. Prem Kumar ji, आपने जो type किया है, I think we might need to ask you a few more questions that doctor might want to. Please be ready to chat on the chat box and reply her. Ma'am, Prem is asking, my wife has uh, SGROGEN. I'm sorry if I'm not reading it right, ma'am. SJROGEN syndrome.
Jogren syndrome.
Yeah, yeah.
Hmm.
And they've been married since 5 years. Is it possible for her to for us to conceive? We have tried two IUIS.
Okay. See, Jogren syndrome usually involves cilia, in which the motility is affected. That means we have two fallopian tubes on both the sides. The egg is released from the ovary and the tube catches the egg. And this egg then moves into the tube. So it moves by the cilia of the tube. The cilia push the egg forward. In Sjogren syndrome, these cilia they get affected. So if the cilia are affected badly, then the egg will not move forward. The sperm will not reach the egg, and it becomes difficult to conceive. In such cases, IUI may also not help, because in IUI we just keep the sperm in the womb. Then it has to travel to the egg. So this traveling may become a problem in some severe cases. So
Yeah.
I think you should try one more
Sorry.
IUI. Yeah,
Ma'am,
tell
one
me.
more addition that I have missed in this question. Pura. I'm not reading it right. Please excuse me.
Okay, Papira.
Well,
Huh.
yeah,
She has
Pura.
purpura as well. The purpura is
Yes.
not an issue. That is mostly because of low platelet count. But Sjogren's, if it is affecting the ciliary motility, then it becomes difficult to conceive even with IUI. IVF is the treatment in which we prepare the embryo and we keep the womb in the womb. The role of the cilia is gone. So that is how it is. It is not that
So
she
IVF.
cannot conceive. Yeah, but she will conceive by IVF.
All right.
That is
So
how it is.
I hope, yeah, I hope IVF is already prescribed to you, Mr. Prem Kumar. Any other questions? Please go ahead and type further. But for now, that's the answer from Dr. Parul Sathe. Next question is Amrita Singh, 33-year-old female. Manjit Singh, a 34-year-old male, trying to conceive since 2 years. Not able to conceive. All her reports are normal.
Okay. First of all, trying to conceive means what? That is what trying to conceive is different for different people. Huh? Some girls who are working, they have weekend sex because they are free on Saturday, Sunday only, and they say that we are trying for 2 years. So we should understand what is our fertile period, when we should try to conceive, and when are the chances to conceive. So, in a girl who is having regular periods of 28 to 30 days, she ovulates only once, and that is around 14th, 15th day of her period. So, that is the time, that is the window which has to be covered. If your first weekend was on 10th day and next weekend is on 17th day, the window is gone. So, that is what we have to understand. So, if you are menstruating regularly between 10th to 20th day of your period, you should have alternate day sex, then the chances of conceiving are high. In case if you are not planning this way, please try to plan like this. And if you are already planning like this and you have been trying for 2 years and you are not able to conceive, please consult the gynec. Then you need
Right.
additional help.
Right. These are very, very important informations. This kind of education, the antenatal planning, the prenatal planning, the pregnancy planning, इनके बारे में हमें बताया नहीं जाता है. जितना हम लोग शादी के बारे में या पार्टनरशिप के बारे में importance देते हैं, we don't even talk about them, and then everybody wants a ready child.
Yeah,
This
true,
kind of
true.
education is very important.
There is a myth that if we have sex during menses, chances of conceiving are high. So that is
अच्छा.
also being practiced in India. Yeah. When we talk to patients, no, openly tell me, how are you planning, when are you planning, when are you having relations, then we realize those 5 days are the important. That is what they feel. Actually, it is
Oh,
not like that.
so
Those are the
it's a
days. If you, it's a myth.
yeah.
The people
So
are
it's a
following
myth.
that for years together. So we
So
just
the best
explained them.
time, yeah, the best time to plan for a pregnancy is to have sex from in the ovulation period. That is
Okay.
the window that you have mentioned, 10th through 17th day.
20th, 10 to 20th day, alternate days you have relations. Because around
Wonderful.
14th, 15th day, egg will be released. Now, I don't know exactly, it will be 14th day, it will be 13th day, or 15th day. And the egg, once it comes out, it is viable for 24 to 48 hours, not more than that. So that's why alternate day
Right.
is very important.
Right. And also, ma'am, having a nice, long, constant, stress and then lifestyle issues, all these are factors which you have already spoken about.
True,
One has to
true. That
maintain all of
has
that.
to be, yes. Means you should be relaxed. You should know that now my priority is conceiving. So the more I will be relaxed, the more I enjoy my life. Nowadays people are not enjoying sex. They are doing it for the purpose of producing a baby. That is how the things
Okay.
are. So you please, yes, 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 they are under pressure of their family. अरे बच्चा कर लो. Mother-in-law says तुम कर लो मैं संभाल लूंगी. This is the attitude nowadays. So this also they are doing for the purpose of producing, like a factory. अभी करके देना है. So when you are not involved, then again it becomes a stress, no? Because करके देना है. So that stress
And one
only
has
really.
to, one has to welcome the child in all means.
Yes,
Whenever that you're
yes,
ready and you've got to prepare, plan, and then welcome the child. Otherwise, it's
yes,
going to
yes,
be a burden all through and going to cause stress. So,
yes,
ma'am, next question that we want to take up is uh, Swati, 29-year-old who wants to conceive but not able to conceive. Same, I think we've just talked about it. JVF इनका नाम नहीं दिया है. 43-year-old female है. Had my first baby at the age of 32. I am planning for my second child, but I am unable to conceive since the year of 2018. Your advice of how can I conceive naturally? तो JVF 43-year-old है. First baby, 32 year
First of all,
old.
I would like to know your AMH JVF, because since you are already 43, I assume that your AMH must be low. That is why you are finding it difficult to conceive now. That is the importance of the age in conceiving. If we are late, rest everything is normal. You have same womb, you have same tubes, but the ovaries have already grown old. So you have to eat antioxidant rich diet. That means you try to eat dark colored fruits and vegetables. You take proteins in your diet, high fiber diet, and you exercise regularly if you are planning to conceive naturally. Right now, in your case, the fertile window also varies, because usually at 43 years of age, we are not menstruating regularly. So we cannot predict exactly when you will ovulate. So you can take help of LH kit that is available in the market. It is also available in our pharmacy in the name of ICAN kit. And you can see when there are two lines, these two lines predict ovulation. So when there are two lines in that kit, that means you are about to ovulate in next 2-3 days, and you have relations then and track. Okay.
Yeah.
Here the
मैम
age
ये
factor is the.
इम्पॉर्टेंट जो आपने एलएच किट के बारे में बताया है बट देर आर अदर फेज ऑफ अंडरस्टैंडिंग योर बॉडी ऑल्सो शोज सर्टेन साइंस व्हाइल यू आर ओवुलेटिंग is it important
Yes.
to follow those charts and keep your what are your body's symptoms that it is showing
So
up?
it is like basal body temperature which goes high around ovulation. Then the mucus, ovulation mucus, it becomes sticky at around ovulation. These are the two main symptoms. How you understand that yes, I am ovulating. Some women they get ovulation pain or mittelschmerz during at the time of ovulation, and they tell yes, now I am ovulating. So these are few symptoms how you can understand. But if you are 43, you are mostly not ovulating regularly because of your age, so you need help in that form, and you are trying naturally, so at least you should be able to understand when you are ovulating, right?
Yeah. And then ये जो आपने बताया है एलएच किट इन अपोलो 24/7 फार्मेसी में क्या नाम पे मिलता है?
I can.
All right. So I can be ordered on Apollo 24/7.
Uh,
Is it, ma'am? Is it on prescription or anybody can order
no,
it?
anybody can
Right.
this
So
is
you can
something
find
which
it
you
on.
can use.
Yeah.
Tell.
Great. So and जो टाइम पे करना है उसी टाइम पे करना है और ओवुलेशन के विंडो में ही करना है.
Yes, that is very important. Right.
You buy
This
your
is
ICANN kit and you do it on your fifth or sixth day of your of your cycle. It doesn't
of
show.
no use.
Yeah.
So
Great,
you
ma'am. Thank you
start
so
by
much.
means after 12th day. Yes.
After
After 12th
12th.
day, you'll have to use.
Great. Thank you so much, ma'am. Ma'am, here's about supplements and medications. Leela is 32-year-old. How to avoid more medications? She means tablets during pregnancy and how to be active through natural food and supplements.
Perfect. So, in first 3 months of pregnancy and before planning pregnancy, we advise you to take folic acid and vitamin D. These are very important. Normally, before planning pregnancy, we give you folic acid supplements. Folic acid is rich in green leafy vegetables. So, if you are eating plenty of green leafy vegetables, more in raw or half cooked form, the problem is the way we prepare vegetables, we overcook them. So all the vitamins, especially water soluble vitamins, are lost. So if you take green leafy vegetables more in the form of salads and all or soups and all, it will help and you can avoid folic acid. And vitamin D, all of us know, please take sunlight. Please move out of your AC rooms. Then you will absorb vitamin D, so you need not take supplements. But the only thing is, when we do vitamin D levels, almost all of us, our levels are low. That is why we need to supplement, because it has been seen that if the vitamin and mineral levels are low in a woman, then the chances of conceiving reduce, because each and
Oh,
every small micronutrient plays its vital role in conception. That is why we give the supplements. We give multivitamins and folic acid for this reason. Okay.
all right,
So
ma'am.
healthy
Wonderful.
diet again. Hmm.
Yes, ma'am. So please continue, ma'am.
So healthy diet again, green leafy vegetables, antioxidant and vitamin rich diet is what you have to take. Right?
Yeah. And if you're unable to eat so much because pregnancy again has lot of, you compromise on your nutrition values because you're unable to eat, you're throwing up constantly, the capacity of your stomach goes low because of the growing baby. All of these, you are compromised on your nutrition, though you think that you're eating well. I was
Yes.
severely deficient. I was working, I was quite active, unable to eat, if I can remember my pregnancy time almost 20 years ago. So I used to eat very little and, multiple meals, but I couldn't get that kind of nutrition. So I had to take supplementation.
Supplements. True. True. That
Yeah,
is what, no, and especially in India, we don't take care of ourselves. For us, family is first. You will cook nicely for your husband, you'll serve him, your in-laws, your kids, and then you. So it's better to take supplements so that you are fit. That is very important. So that's why we
yes.
give iron and calcium supplements.
आई थिंक दिस
That
इज
is the reason.
टाइम व्हेन वी टॉक अबाउट सप्लीमेंट्स के साथ एक्सरसाइज के बारे में बात करेंगे बिकॉज
Yeah.
प्रेगनेंसी एंड एक्सरसाइज एंड बीइंग एक्टिव फिजिकली इज इम्पॉर्टेंट.
So it's very important to be active during pregnancy. We have to do light exercises in first 3 months. Swimming can be done, walking can be done even in the first 3 months of pregnancy. Usually, I don't know why people are saying that first 3 months we should take complete rest. No, it's not like that. If the
That's a
pregnancy
myth.
is okay, if everything is fine, you can definitely exercise in first 3 months also. Avoid doing vigorous exercises during first 3 months of pregnancy. In second trimester of pregnancy, definitely you can do all sort of exercises, moderate exercises. Third trimester, of course, you can do. So exercise should be done during pregnancy. If you are exercising continuously, if you are active, chances of normal vaginal delivery increase, chances of backache during pregnancy reduce, chances of pain in legs during pregnancy reduce. So you have to exercise regularly. Remember, you are just pregnant, you are not a patient. I don't know, we have that notion, or a pregnancy hai. It should not be that way. It's a natural process. Please enjoy your pregnancy. That is what we need to do.
Wonderful, ma'am. So each trimester, you can continue doing your exercise. That is every 3 months. Please consult your gynecologist and trimester appropriate. ये 3 महीने के लिए आप क्या कर सकते हो? पूछ लीजिए and करते
Yes,
जाइएगा. Be active.
true.
Yeah.
Yeah.
मैम इंदरलोक जी का एक क्वेश्चन है जो हाई रिस्क प्रेगनेंसीज के बारे में है. Let's also talk about what high risk pregnancies are and then you can answer this question. What is the role of injection हम लोग 500 mg in women who have high risk pregnancies? So let's talk about what high risk pregnancy is first.
Yeah. So when you come to us in the first visit only, we try to talk to you. We try to understand if you have any pre-existing medical condition. This, if there is hypothyroidism, thyroid disorder, diabetes, hypertension, any medical disorder, will anemia, we label it as high risk pregnancy. Some women, they have history of previous 2 or 3 miscarriages. That is considered as high risk pregnancy. Some women, they were trying finding it difficult to conceive on their own, so they took ART, some artificial reproductive technique, maybe IUI, maybe IVF. It is considered as high risk pregnancy. Twin pregnancy is considered as high risk pregnancy. So these are the definitions of high risk pregnancy. In high risk pregnancies where there is history of previous miscarriage, or IVF conception. In such cases, we give injection humog and prolyton depot, means progesterone and HCG injections, because progesterone is the hormone of pregnancy. This is the hormone which keeps our womb silent. Normally what happens is, when are the chances to abort? When the womb starts contracting over the baby and the baby is expelled. So the hormone of the pregnancy keeps it silent so that it does not contract over the baby and does not push the baby out. In high risk pregnancy, where there is history of previous miscarriages, or it is an IVF conception, when we know we have to save this baby, we give these injections from outside so that the womb is silent and the pregnancy goes on well. That is how it is. I hope
Wonderful,
I'm.
ma'am. So, yes, ma'am, it's very, very important to trust your gynecologist or the expert who's helping you do through the conception. क्योंकि हमारे पास इतना information बाहर है कि हम लोग, we tend to distrust our expert. So I request, pregnancy is something that आप सौंपो, आपका responsibility expert के हाथ में सौंपो, and they'll take care of you.
True.
Yeah.
True.
Next question, ma'am. Here's Gyanendra. Namaste, doctor. 27-year-old girlfriend has got periods and got disturbed. Her periods got disturbed and we thought she's pregnant. So we used urine strips to check. The results were positive. So to be sure, we checked 4 more times and the results are positive and negative. It is like mixture of results. So what should we do now?
In such cases, we normally do a blood test, which is known as beta HCG. You can just go on the app, click on it, get the test done, and it is 100% confirmatory whether you are pregnant or not pregnant. So if it is less than 1.2, you are not pregnant. Kits are many a times false positive, false negative. If we are not able to rely on the kit, we just do this test and we are 100% sure of whatever it is. And please do it
So,
early so that you do it in time and we can
yeah,
help you. If the pregnancy grows big, then she's unmarried. She's his girlfriend. I don't know whether she wants to continue or no. So you
continue or
should take.
not.
Yes, yes, yeah.
Yeah.
So
Now
you should
that the
take time.
yes, yes. Now you have to, ये multiple times ये जो strips available है बाहर से urine के test kits available है. So they might show up or they might not show up. But as you
Yeah.
said, the blood
If
test
the
is
kit
a
is
sure shot.
faulty, yes, yes. Do beta HCG blood test. That is sure shot. You can go do it anytime.
All right. And Apollo 24/7 is always there, and you can consult the experts as well online, and you can consult Dr. Parul Sathe on Apollo 24/7 app as well, whichever city that you are in. Dr. Parul Sathe is in Mumbai, but she can be consulted online as well. All right.
Anytime.
Her link to consult Dr. Parul Sathe is also left in the description box and the chat box as well. Please go ahead and book an appointment if you require her consultation. My next question is Bharti Rawat, who is 35-year-old female with 2.5 AMH and had 2 recurrent miscarriages, naturally conceived. All advanced test reports are fine for both of us. What should I be doing next?
Okay. So, madam, when you conceive next time, please keep yourself stress free. If you have had this miscarriage twice, doesn't mean that it will happen again. That should be very clear to you. Okay. Since all your tests are normal, so that means actually there is no fault with you or your husband, right? So you should be relaxed that everything is okay. So this time pregnancy will go well. In such cases, usually we give some masala treatment like these hormones and all, and tender, loving care. That is what is most important. So you should be stress free and you should try to relax. The pregnancy will go well. Stress is the most common factor which is leading to recurrent miscarriages nowadays. And also in such cases, means we advise you call your mom, or you please stop working for some time. You please try to keep yourself stress free, or don't take stress of those targets. That is most important. Okay.
Ma'am, I'm liking your attitude so much that I've become a fan of yours. तो
Sorry.
मसाला तो देते ही है, but tender loving care. क्या क्या
Actually,
एकदम
that
बस
is most important. We are trying to help you, but we need your support also, no?
Absolutely, absolutely, ma'am. Chaliye, so congratulations that you are now pregnant again, and I hope you got the point that Dr. Parul was trying to say, Bharti. So have a safe pregnancy and wonderful time ahead. Yeah. Next question is. अरे रूबेला का क्वेश्चन लेना था मैम हाँ प्रकृति Budvaik. I'm sorry if I've spelled you wrong. Hello, doctor. My rubella test has come equivocal twice, and my gynec has suggested vaccination. Is there a particular day after the periods that this vaccination has to be taken, like between fifth or eighth day, or any time?
You can take this vaccine anytime, and mind you, you should not conceive in 1 month after taking this vaccine, because when we give the vaccine, we are actually injecting a virus in your body. It is inactivated virus, so it may also affect the pregnancy. So take a break of at least 1 month and then plan to conceive. You can take it
Right.
anytime.
Anytime that you can take, and this vaccine is supposed to be saving you and then giving you रक्षा कवच बना के बेबी को और आपको
True,
संभाल
true.
तो ले लीजिए
Yes.
and then take care of yourself well. My next question is a registered users question जिनका नाम V है 26-year-old है 9 days from my last period she's missed 9 days is that the way that I will
What?
say it? 9 days from my last period. I took beta HPC test and not pregnant in that. Never missed my periods before. So asked a doctor and I'm taking progesterone tablets 10 mg in the morning and night. Should I be worried about this? And what are the factors
No,
which can
no.
cause these delayed periods, ma'am?
Yes, yes. This is very common nowadays, very common. If you discuss with your friends and colleagues, you will see 2 to 3 girls out of 5 girls are having this problem nowadays. Okay, so in 2 or 3 times in your lifetime, this is going to happen. It is not that every time it is pregnancy because of which you are having this problem. Sometimes exam stress, sometimes work stress may lead to hormonal changes from the hypothalamus, from the brain, and hence delayed periods. So, to allay your anxiety, we are giving you these progesterone hormones for 5 days. After stopping this, you'll get your menses and then they will be okay. If not, then we will help you further. That is how it is. Okay.
Yes.
So, you,
Ma'am,
in
now
one, huh,
yeah, and now
so you have,
generally asking you कि ये जो delayed periods है कब हम उनको कह सकते हैं कि period हमारा at an average time नहीं आ रहा है so एक बार
oh,
दो बार नहीं कितने दिन हमें कितने महीने हमें देखना है कि ये periods are not regular.
see how it is. You should see over a span of 3 to 6 months. If continuously your periods are delayed, then you need help. Okay, then we do your blood tests and sonography, and most commonly the situation we see is PCOS in such cases, polycystic ovarian disease. That is very common, which leads to delayed. Means 1 in 4 girls has PCOD nowadays. Okay, so we should understand that this PCOD is again a very common disease. 1 in 4 girls has this, and there is no cure to this PCOD. So no medicine is going to cure it. Ultimately, it is again weight loss. If 5% weight loss is there, your periods will become regular. So again, the treatment comes down to diet and lifestyle, and we give you hormones from outside so that you start getting your periods regularly, and you are mentally at peace ki yes, I'm getting my periods regularly. But we are not going to cure your situation by doing this. This is a temporary thing which we are doing to help you out. Ultimately, you have to lose weight, and that is how you will be able to control the situation, not cure it. Okay.
Yes,
So at
yes,
least
and
three to
that's why
six months.
6 months. And ये PCOD का booth जो है ये Indian women are being affected. ये तो quite common हो गया है and इतना दिखता है हर
It is a
10 लड़कियों में
lifestyle
एक.
disorder. It is
हाँ.
a lifestyle disorder. So lifestyle is changing. So PCOD is rampant nowadays.
Right, ma'am.
So
Yes, ma'am. Next, let's continue with other questions as well, ma'am. इंद्रलोक जी फिर से पूछते हैं what's the significance of being tested for TORCH infections before pregnancy and in the pregnancy? So can you
torch
also
infection
understand
is
TORCH? Torch
torch
बोलते हैं.
infection is this is a group of viral infections. Toxoplasmosis, other viral infections, rubella, cytomegalovirus. These are all viruses. V stands for viruses, varicella virus. So we do these if there is history of one miscarriage, many a times we are very apprehensive. Why did it happen? Why did it happen? So we try to test for these viruses. As I told you, rubella virus is known to cause fetal malformations and miscarriages. So these viral infections are known to cause miscarriages one time, not every time. Okay, so we do these tests. If any of the test is positive, we can treat you accordingly. So we want
Yeah.
to rule out any viral infection as a cause of your miscarriage. That's why we do this. Torch is a short form for viral infections.
Okay, ma'am.
I hope
Thank you. Yes, ma'am. Next question is a registered user's question. Does PCOD affect pregnancy? If yes, what to do?
30% of girls with PCOD will find it difficult to conceive. Okay, so if you have PCOD after your marriage, you should not do time pass. I will take 2 3 years to understand whether I'm doing well with my husband. Then I will plan my pregnancy. So 3 years you're using some contraception, and then you start planning, and then you find that, oh, I'm finding it difficult to conceive. So the thing is that, as you know that you have PCOD, so chances of conception might be a problem for you. You please plan your pregnancy early and focus on weight loss. Okay, your weight has to be under control to keep your hormones under control. If your hormones are under check, things will be better. You try for 6 months. If you're not able to conceive, please consult the gynec. That is very important in cases with PCOD. So how I counsel my girls is, if they come to me before marriage, I tell them, you just do your lifestyle management. That's it. When you are marrying, and you please plan your pregnancy early. If you are not able to conceive in 6 months, take our help. We'll help you out. That's it.
Wonderful. Inderlok ji, आपने पूछा PCOD and metformin के बारे में. We've done an entire episode on PCOD and PCOS. We can leave a link for you, or it's there on Apollo 24/7 as well. Please go ahead and check that there. Next is registered user question again. How to get over pregnancy cravings and eat healthy, and how to balance the nutrition? Ma'am, I think I can't see you. Your technical difficulties at your end. I would request you to refresh and come back. In the meanwhile, let me tell my audience that we are coming towards the end of the show. Dr. Parul Sathe will be joining us, and she'll be giving us top tips as well. And also on this show, we are going to have a health quiz. I'm going to ask you 3 questions, and if you want to participate in the health quiz, you got to type your answers only on YouTube chat, and YouTube chat पे ही मैं answers देखूंगी और winners को हम declare करेंगे. If you are watching this on Instagram or Facebook, and if you want to participate there for if you're typing your answers on there on those chat boxes, I will not be able to select the winners. So winners will be selected only from YouTube chat box. Also, towards the end of the show, we are giving away gift coupons, which you can use, and discount vouchers, which you can use on Apollo 24/7. If you're already using Apollo 24/7, well and good. If you're new to this platform, please download Apollo 24/7 so that you can use the gift vouchers that I'm going to announce in a short while on the platform itself. Well, I think doctors still facing difficulties. Let me, in the meanwhile, reiterate that lifestyle management, alcohol से दूर रहना, smoking से दूर रहना before you plan pregnancy is very, very important. And also, having all your tests done before you're planning pregnancy, correcting in case that you have any of these disorders is important. And once you are confirmed with pregnancy, then there are a lot of tests to be done, and those you need to follow under your gynec supervision. First and foremost, no stress, no anxiety. Whenever you're ready, whenever you want to plan, that's when you need to plan pregnancy. But unfortunately for women, or fortunately for women, एक time window में आता है. So you got to understand your body and your ovulation period. जितना जानकारी आप ले सकते हो, जितना आप informed रह सकते हो, उतना informed रहिएगा, and make sure that you are having a good welcoming time to plan pregnancy. Eat well, keep yourself calm, take your partner's support. This is not just you who's going through the pregnancy, so let your partners be a part. I'm very happy that today's audience, a lot of men have started to ask questions, which is very important. We know that there are couples who take care, pregnancy as a unit. It's not just a woman's issue. Yes, Dr. Parul is back
I'm
with us.
very
Yes,
sorry.
ma'am.
I thought I got disconnected. I'm very sorry.
No problem, ma'am. Yes, I was just reiterating whatever you had said. Huh. So, ma'am, cravings and food, ma'am.
Hmm. Yes, cravings and food. So in first 3 months, it is all of us mostly we have nausea, but we are not able to eat properly. We have heartburn. Then there is gaseous distension. We are feeling bloated all the time. So how to come over all these things, right? So in first 3 months of pregnancy, we should take small, frequent meals. That is very important. Oily and spicy food is going to create problem for you, so you please see what things suit you. Usually what we advise is you take some dry toast immediately after getting up from the bed, so it helps reduce the early morning, morning sickness, typical morning sickness. And then 2 hourly you take some dry fruits. Usually people like idli during their first 3 months of pregnancy. Some girls they like rasgulla, some girls like ice creams a lot. So you have to find out what suits you, because this first trimester or the first 3 months at the time when we cannot force you to eat anything. Your body is also adjusting to a very new change. In a train, in a compartment, if new passenger sets in, how we try to reject, how we try to resist initially, and gradually the passenger adjusts in the compartment. That is how our body is. In the first 3 months, our baby is trying to adjust in our body, and physically our body is trying to reject. We are not liking that change. So we have to go with the flow, and whatever cravings you have, whatever suits you, whatever you find good for you, please go for it. Then in the second trimester, things settle down, and then our dietary advice comes in. Then we can tell you, yes, you have to have 5 almonds daily, one walnut daily. You have to eat 2 egg whites daily. You have to take 2 cups of milk daily. You have to take green leafy vegetables and salads daily. You have to take high fiber rich diet so that the constipation of pregnancy is reduced. Plenty of water, 3 to 4 liters of water daily, will help reduce your bloating and constipation. So, and you can eat chicken during your first 3 months also. You can eat fish during your first 3 months also. I don't know why people avoid all these things, except for mercury containing fish. Mercury containing fish should be avoided during first 3 months of pregnancy. If you want to go down, you please avoid eating lots of pineapple and papaya. Rest all fruits can be eaten during pregnancy. So, in short,
Wonderful.
this is a natural process. Please enjoy your pregnancy and eat healthy food during your pregnancy. That is how it is.
Wonderful, ma'am. Thank you. And as we're running short of time, I would now stop taking questions from the audience. Now it's time to give us, for you to give us top tips of how to plan a good pregnancy. What are the do's and don'ts?
Yeah.
So if you can reiterate some top tips, please.
Yeah, sure. Planning pregnancy, age is very important. Please plan it as early as possible, especially in your late 20s. Planning pregnancies prior to planning for 3 to 4 months, quit alcohol, quit smoking. That is very important. Please take healthy diet. Please exercise regularly for 45 minutes in a day, at least 5 days in a week. When you are planning pregnancy, please take folic acid and vitamin D supplements and maintain a healthy weight. If you have medical problems, like if your BP is high or your sugars are high or your thyroid is deranged, please meet your doctor and take supplements, take medicines for that. Keep these things under control and tell them that you are planning pregnancy, so that the doctor can give you a medicine which is safe for your baby, so that even if you are pregnant with those medicines, your baby should not get harmed. Thank you.
Wonderful, ma'am. Thank you so much for this Sunday morning advice. And please take care of yourself and also wonderful children who are going to come into the world. Thank you so much, ma'am.
Yeah.
Yes, and here we go ahead with our health quiz. I'm going to ask 3 questions, and please answer these questions in the YouTube chat box only. Winner's name will be announced towards the end of the show, and winners will be selected at the sole discretion of Apollo 24/7 team. If you are declared as a winner, you have to write back with your contact details to marketing@apollo247.com, and gift vouchers will be shared with you. If you do not write back to us before Tuesday or Thursday, before Tuesday and Wednesday, we'll not be able to share the gift vouchers. So requesting all the winners to write back with all their details. And here are the questions for today. The first question today is true or false. Nutrition during pregnancy is different from the non-pregnant state. True or false? Nutrition during pregnancy is different from the non-pregnant state. Question number 2. Fill in the blank. Pregnancy is divided into T-R-E trimesters approximately. That the question, frankly, is how many trimesters, okay, is pregnancy divided into? Fill in the blank with the word there. And question number 3, yes or no में answer कीजिए. Prenatal care may also include avoiding alcohol and smoking. Prenatal care may also include avoiding alcohol and smoking. Keep the answers coming in the YouTube chat. I'm waiting for your answers. And in the meanwhile, let me also give away the gift vouchers. Ask Doc 150 is the code that you can use on Apollo 24/7 to consult top doctors direct from Apollo and get 150 rupees cashback. And you can use this on Apollo 24/7. Download the app and use it. The next one that we give away today is first 3 FIRST. First 3 order medicines direct from Apollo and get up to 25% off on online medicine orders. And this is valid on the first 3 orders above 1000 rupees each. And you also get up to 2-hour delivery free as well. Next one that we give away exclusively for our Health Hour viewers is HH247. Use the code HH247 to get 199 off on online consultations with Apollo doctors and up to 20% off on medicine orders as well. As I've announced before, now Apollo 24/7 is also on WhatsApp. आप WhatsApp text या call कर सकते हो to book medicines or to book lab tests. 9355247247 is the number. Avail healthcare services from Apollo on Apollo 24/7 on WhatsApp as well. Chaliye, next week we are talking about a very common but interesting and an important subject, gallbladder stones. We are going to talk about gallbladder stones, treatment, diet, myths and facts about it. So please join us next Sunday, that is 2nd of July, 11 a.m. and we'll be taking your questions. Let's see who's all started to answer and I'm waiting for all right, हमारे regulars पूरे आ गए हैं यहाँ पर. All the okay, I see Harsharan Kaur, Anmol Agarwal, Jeff, Madhu, Suran Kumar, Kavita Agarwal, Ranjit. Oh, a lot of you have started to answer and I'm waiting for my team to select the winners and type it out. Madhu, Suran, Ranjit, congratulations. And I'm also waiting. Madhu is number 1, Suran is number 2 and Ranjit is number 3. Congratulations. Please write back to us and claim your gift vouchers. फिर next हफ्ते मिलते हैं. Thank you so much for joining us this week. Namaskar.